Hello, this is Lauren Bird doing a full body assessment on an adult patient. So first, when I have my patient, then I'll introduce myself and evaluate his mental status. When I first walk in, I do my hand hygiene and I introduce myself. Hi, I'm Lauren. I'll be your nurse today.
Nice to meet you, Lauren.
How are you doing today?
I'm doing all right.
Can you tell me your name and date of birth?
Aaron Gait, 26842.
And where are we? Where do you live?
I live in Arlington,
And what state is that?
Texas,
And where are you right now?
in the hospital.
Okay, perfect. As he is talking to me, I also will obtain a history and physical, getting his background of any diseases or conditions or anything in his family history that is pertinent to his health. Next, we will start I will start my evaluation. So next, I will ask him to memorize 3 phrases. Hot cross bun.
Hot cross bun.
It is what it is.
It is what it is.
Reach for the stars.
Reach for the stars.
Okay, so he will have to remember those, and then I will ask them what those phrases are in a moment. As he's memorizing the phrases, I also assess how his affect is, his personal appearance, and his speech to evaluate his mental status as well. Now, what are those 3 phrases that I told you to memorize?
Hot cross bun. It is what it is. And reach for the stars.
Awesome. So that tells me his level of consciousness, his language and thought process, memory, visual, and spatial skills. Now we'll start my hands-on inspection. First, I will do his head. May I touch you?
Yes, you may.
Okay. I will inspect for skin lesions, and I'm also inspecting his hair to see if it's thin or thick or if there's any issues. Going all over his scalp, palpating and inspecting behind his ears and his neck, looking in the ears, touching, feeling for any abnormalities and symmetry. Down his neck for any skin issues and problems or asymmetry. So then I'll inspect his eyes and his face and his jawline and his mouth. Next, I will continue with my inspection of the head, and we will look at your eyes. Can you raise your eyebrows up and down and squint your eyes and open? Okay, let me check your neck. Put your neck all the way back, down, all the way to your chest, up, to the left, or right, and then to the left. Perfect. Any pain doing that?
No.
Okay, when he has his head to the right, and then I will palpate this muscle, look at his carotid to see if there's any issues, and then we go to the left, right, do the same thing on the other side. No issues. Perfect. So I'm going to have you look straight ahead. I'm going to check his pupils and his sclera with my ophthalmoscope. Okay, look straight ahead. Okay. Perfect. His pupils are equal and reactive. So now I'm going to look in your mouth. You open your mouth and close and open again. I'm going to look at his inside for any lesions or anything, any redness or swelling. We're going to look at his teeth as well. Stick your tongue out. Say ah. Perfect. Thank you. Next, I will look behind his jawline. See if there's any. Do you have any pain anywhere in your face?
I do not.
Okay. So now with my otoscope, I will look in his ears. So now I'm going to check your vision. Follow. Perfect. Any pain doing that?
No, ma'am.
Can I have you frown for me? Perfect. So now read the smallest numbers at the bottom. Cover one eye, sorry.
5, 4, 2, 1, 6, 8, 10, 3.
Perfect. Cover the other eye.
5, 4, 2, 1, 6, 8, 10, 3.
Perfect. Thank you. Now I'm going to check for some sensory in his face. Is it equal?
Yes.
Right here, you feel it?
Yes.
Feel that?
Yes.
I'm going to check again for any lymph nodes and his lymph glands in his neck. Don't see any. Can you shrug for me? Perfect. Do it again. Hold. Perfect. Okay. Relax. I'm going to check. Close your eyes and see if you can feel this.
Yes. 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 Yes.
Perfect. Open. So now we're going to check your peripheral. Hold your hands up. Arms up. Out. Hands back. Open your fingers. Close. Down. Okay. Okay, so make a fist. Okay, push up. Okay, push down. Okay, resist me as I try to open your hand. Perfect. Open your hand. Push your hand back. Push against me. Okay, perfect. Open. I'm gonna check your push. I'm gonna check your biceps. So push against me. Perfect. Arm out. Push up. Okay, push down. Okay, push your arm back. Okay, pull your arm forward and back. Perfect. Relax. I'm going to do the same on the other arm. Up. Put your fist. Try to resist open. Okay. Push up. Down. I'm going to check your biceps. Push back. Okay. Forward. Okay. Arm out. Push up. Push down. Then your arm back. Push forward. Push back. Perfect. Relax. I'm going to also check your pulses. Radial. Brachial. Carotid. Perfect. I'm going to check the cap refill. On all fingers, make sure they're pink. While I'm looking for his cap refill, I am also looking at his cuticles. Okay. And checking his skin for any abnormalities. Now we'll continue the assessment of his chest wall. So as I'm looking at him, I'm looking at his breathing, looking at his work of breathing, see if he's having any visible issues, and then I will start my assessment. So I'll start with his chest, look at his clavicles, no issues there, and go down, raise your arms up, and I'll feel under his spine, and feel on his ribs. No issues. Do you have any pain anywhere?
No.
Okay. Perfect. You can relax your arms. And now we'll auscultate his heart and lungs. His heart at the PMI. And then listen for each the atrium and ventricles. Can you take a deep breath? Okay. 2 seconds is good. Okay. Perfect. His lungs are equal and clear. His heart has a good, strong rhythm with no valve abnormalities. Do you have any history of any heart conditions?
I do not.
Okay, perfect. So now we will move into the laying down position where I will continue his chest and his abdomen. Next, I'll have my patient lie down and continue my assessment. I will start again from his head and check his neck and move down. I will assess his breast area and make sure the nipples are symmetrical and no discolorations. I will palpate for any lumps. None noted. Then we move on to the abdomen area. I will also be looking at his work of breathing as well and the lying down position. On the right side for his liver. Any pain there?
No, ma'am.
Okay. On the left side for his spleen. And I will also feel for his ribs. One deep breath. Perfect. I'm going to have you sit up and put your neck, not sit up, oh, just your neck to your chin, chin to your neck. Perfect. Relax. Okay. And then I will also percuss. I will palpate his abdomen. Any issues or pain?
No, ma'am.
Okay. Next, I will auscultate his gastric area, all 4 quadrants. Next, I will evaluate his lower limbs. First, I'll palpate his pelvic area, check for symmetry, and then move down and look at his skin, see if there's any abnormalities or any pain. Sir, you have experienced any pain?
No, ma'am.
Okay. And then for his genital area, I'll ask if he has any abnormalities or any issues or any pain or anything that we need to discuss so that I can pass on to the provider. Any issues?
No, ma'am.
Okay. I will continue my assessment on his lower extremities. Assessing his skin for any lesions or abrasions of any sort. Starting with his kneecaps, calves, his ankles, all the way down. Patient is uncomfortable with assessment of his feet, but verbalizes no pain or concerns. Next, I will have him lift his leg. Okay, push. Perfect. Relax. Any pain there, sir?
No, ma'am.
Okay. We'll do the other leg. Push. Perfect. Okay. Any pain or discomfort?
No, ma'am.
Okay. Now I will assess his spine from the back. I will look at his skin all over to see if there's any lesions or color discolorations or abnormalities. Then I will palpate his spine, then his muscles on the side, and then I will percuss, starting from the top to the bottom. Sit up and pull your arms out. I'll assess his lats, deltoids, and his ribs going down. Okay, perfect. Arms down. Okay, breathe deep. Okay, perfect. Now we'll percuss. And assess his spine. Now I will auscultate. Moderate breath. Since I'm here, I will also auscultate his carotid. You can relax. When assessing his back, I will also percuss with my fist. Now we will continue with his motor and sensory. I will have him identify if he feels objects in a particular area. Close your eyes.
Yes. 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 Yes.
Okay, so now I'll have him tell me if it's sharp or dull and the location. So tell me where.
Left shoulder, sharp. Right forearm, sharp. Right shoulder, dull. Left forearm, dull.
Perfect. Now I'll have him tell me if it's warm or cool.
Cool. Warm. Warm. Cool.
Next, I'll have him identify objects in his hand with his eyes closed.
Paper. Clip. Pen.
Next, we will assess his vibration. So with my tuning fork, I will have him tell me if he feels the vibration.
Yes. 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 Yes.
Next, I will assess his spine. We'll have him stand up without assistance. Okay, and hop on your toes. On one foot, the other foot, leg up, down, other, perfect. And I'll have you squat, perfect. And turn around and have you touch your toes. Perfect. And when he's touching his toes, I will also assess his spine, see if there's any curvatures, and if he's having any pain. Are you having any pain, sir?
No, ma'am.
Okay, stand up. We'll also check his hips and see if they are in line, which they are. As I wrap up my comprehensive physical assessment with my patient, I will also go over any family history that they did not discuss at the beginning. I will go over their past and current medications, any allergies that they may have, food and medication. We will go over their diet and exercise routines to see if there's any adjustments that need to be made in those areas. We will go over any surgeries and past inpatient hospital stays. And we'll go over any chronic health issues that they're dealing with, that they may need counseling, coaching, or just more information. These things I will pass on to the physician as I wrap up.